Now that we are into assessment and vital signs, I wanted to talk about some breathing patterns we may see with our patients. This is not going to include every possible breathing pattern, but will include several of them. Normal breathing has a nice, easy in and out, pretty regular. Should be able to see the chest rise. Normally about 10 to 20 times a minute in adults. Kids go a little bit faster, and infants go even faster than that. Chain Stokes respirations is one where we see a shallow and slow, getting rapid and deep, and then going shallow and slow, and then a little period of apnea, then shallow and slow, rapid and deep, shallow and slow, and this pattern repeats itself, usually in 30 seconds to 2-minute cycles. Um, I've seen this primarily with head injuries and maybe with some tumors, but I see it a lot in head injuries. It also can be found in patients with heart failure, strokes, and low sodium levels. BS respiration usually is due to damage of the pons, due to a stroke or trauma to the brain, and it's kind of like chain Stokes in that they have this repeating cycle of 30 seconds to 2 minutes of breathing. The difference here is that the depth remains pretty regular. Instead of getting shallow and deep, shallow and deep, shallow and deep, it stays about the same, but then they have a period of apnea, and then they have more breaths, and then a period of apnea. This usually isn't a great prognosis when you see patients with this. Um, as I said, it's usually due to some sort of trauma or stroke to the brain, although opioids can do this too. Apnistic is usually due to damage in the pons or the medulla, and the vagus nerve doesn't seem to connect or communicate as well in these patients. So they take a real deep breath, and then they seem to hold their breath for a little bit, and then they exhale. And then a little period of apnea, and they breathe in, hold the breath, and then they let it out. A lot of times there's posturing with this, so they'll have to corticate or cerebral posturing with this. Ataxic respirations is just a very irregular, abnormal period. Just nothing, no regularity to it at all. Some pauses in there, increasing apnea with it as it progresses, and as it deteriorates, becomes worse, this will usually go into agonal respiration. So this is something we tend to see at the end of life. Hopefully you recognize agonal gasps or agonal breathing from CPR class. This is when they take that occasional breath and then nothing after it for a while, and we're supposed to recognize this as not normal breathing, and maybe not even breathing period, but we'll have to get out the bag valve mask and ventilate them, and may have to do CPR with this because it oftentimes means cardiac arrest. Now, getting away from more of the terminal breathing patterns, this one here is called qusmalls, and you will see this primarily in diabetic ketoacidosis as the carbon dioxide level acidosis builds up in the body because of the way the body's metabolizing fats and acids, or fats and proteins to make acids, and our body's trying to get rid of it. So usually we see this with type 2 diabetics with very high blood sugars, and if you smell the breath, it oftentimes smells a little fruity. While that may be the primary time you'll see this, or the most common time you'll see this, it can also happen with some kidney failure patients, so that's also a possibility with qusmalls. And then central neurogenic hyperventilation. They're going to be breathing at least 25 times a minute. It's deep and rapid, and this is not your hyperventilation because you're upset over an event. This is something different, oftentimes due to some tumors in the brainstem that seem to interfere with how the body is recognizing and processing CO2. And oftentimes they'll have low levels of CO2 with this. If it becomes more irregular instead of a regular type pattern, it may mean that they're going deeper into a coma, into a coma. Sorry about that. So these are a few of the breathing patterns that we're going to see with our patients, so from our EMT students. Hopefully this has been helpful for you. If you have any questions, leave them in the comments below or ask me in class.